Hi, my name's Alice Hart-Davis and welcome to Tweak of the Week. I am in Harley Street at Cosmesurge, a clinic where we're going to go and see Dr. Victoria Manning, who's going to do a thread lift. Now, a thread lift is quite a serious procedure. It's non-surgical, but it does involve needles. Come along and see what it all involves. So, Dr. Victoria, thread lifts. Can you explain exactly what a thread lift is? Because it's one of these procedures that has become really popular quite quickly, it seems.
So basically, as we age, two processes happen. We lose volume from the face, and everything, unfortunately, as we get older, sags. All we're doing, in very simple terms, is just lifting the tissues. So trying to put them back basically where they started off. So the threads that I tend to use a lot of are Silhouette Soft, which is what we're going to be using today in our patient, and they're made of polylactic acid. And what these threads do, they're quite unique. They actually stimulate our collagen. So it's a bit like putting a scaffolding in, and then your body's doing their own work.
Okay. But to get them into the face, you've got to thread them in with a large needle, haven't you?
Tiny
needle.
Tiny bore needle, tiny needle. So what we're doing is actually placing the threads in the superficial fat layer beneath the skin, above muscle and above the fibrous layer in between the muscle and the fat. So basically it's a completely painless layer. They shouldn't feel a thing, and quite a lot of my patients actually fall asleep.
Wow, lost for words. And how long will the results last for?
Again, everyone is different. So if you've got someone who is a gym bunny and running on a daily basis, as you know, they're going to it's not going to last as long. Also, in smokers, it's not going to last as long. So we try and advocate in clinic not to be smoking when you're having any collagen stimulation treatment, because it doesn't
you'd be wrecking it.
Yeah, absolutely. So we're trying to do a bit of lifestyle advice as well. But on average, I'd say about 15 to 18 months is what we get on patients.
Well, that's a decent length of time, isn't it?
Absolutely.
So now let's go meet Helen and then see how the
Exciting.
procedure goes.
Okay.
Yeah, thank you. Okay, so now I'm here with Helen, who is going to be our patient today and try the thread lift, which you haven't tried before, have you? I think you look far too young, but why are you going to have this done?
So I'm 48, approaching 50. I guess I noticed that my skin has lost its elasticity a little bit, especially around here. And it's just something I'm starting to feel conscious of. So
okay, I can barely see it. But if you stop not smiling or just don't animate for a bit and drop your face down,
I look a bit grumpy.
What are you hoping that this is going to change in your face?
I'm hoping just to still look like me, for a natural result, but just a little bit fresher. Okay. Just not so grumpy when I've got a straight face.
Yeah. Okay, and you know what the procedure involves, I know already. So, are you excited about this? Or?
I am excited. Yes.
Okay. A bit apprehensive?
A little bit, but I trust Dr. Victoria 100%. So.
Okay, fab. Right. Let's see how it goes.
So how we're going to do this is we want to decide where exactly we're going to place the threads. I think we're probably going to put 3 or 4 in the mid-face. First of all, mark where I want my last cones to be, and then I am going to just mark my exit points up here, which tends to normally be in the eyelid closure line. So what I'm doing is just popping a little bit of anaesthetic, a little scratch coming up. So we're going to be using Silhouette Soft 8-cone sutures. There's knots. So what we need to do is actually close those knots like that. And I'm going to go down into the fat layer. I'm now going to just drop my thread into the well. This point is really important because I don't want to force it in.
What does that feel like? Do you mind me asking?
I can feel the pressure. Sometimes it sort of smarts a bit. It's just the sensation you can feel, but it's not really painful.
So what I always do is I start from the entry point and then literally work myself down the thread, and you sometimes you can hear it, sometimes you can see it.
Inching the tissue,
and I'm just inching the tissue over the cones.
Wow.
So you can see where the thread is, and I'm just going to work myself from the entry point towards the exit. No gym, basically.
Yeah.
So no impact sports for about 2 weeks.
Okay.
No dental appointments or anything that makes your mouth open wide. So eating an apple after 10 to 14 days, it's pretty much there.
Okay.
But I do try and get my patients beforehand to make sure they're not drinking. I advise them to lay off things like omega-3s, vitamin E, fatty fish, anything that's going to encourage bleeding, and also laying off things like ibuprofen. And then literally aftercare for the patient, I make sure that they wash their hands and they're not touching their faces. And also we advise patients not to go swimming, or also if they're going on holiday, I always say 2 weeks afterwards, because we don't want them slapping loads of sun cream on or sitting in the sun, anything that is going to potentially cause any concerns.
Oh wow!
You look like it was mostly very comfortable. You said it was just where it came out in the hair.
It's a funny sense. It's an odd sensation, but
it must be.
Yeah,
but the tugging and
I sort of expected that, and it's a little bit uncomfortable, but it's not
Yeah.
bad. It's no worse than
Brilliant.
going to the dentist or something like that.
So that was a Silhouette Soft Thread Lift, and we're going to catch up with Helen in a couple of weeks' time to get some after pictures once her face has healed up properly and the little bits of the marks of the entry points has calmed down. So thank you very much for watching, and see you next week.